Thank you, and good afternoon, everyone. I really appreciate the chance to be part of this very important discussion today. And I think that that picture of child poverty in the U.S. that Dr. Wilson Simmons just gave us is very sobering. But I know that many of you are aware of a number of significant proposals now at the federal level and across many states that are aimed at strengthening early care and education programs and other important family policies. And so that's quite a hopeful sign. And as Renee said, I think that one of the important messages of this forum that we want to convey is that we really do have a good understanding of many of the kinds of policies that would improve the lives of low-income children. And having that knowledge puts us far ahead. Today, what I'd like to do is highlight some policies that I think we have an urgent need to advance, and they're also policies that are very well supported by the research we have that tells us how we can help children start school ready to learn and with the support that they need from their parents. So I'll talk first about policies that strengthen not only access to early care and education, but also quality and continuity. And then I'll underscore the opportunity we have to ensure that some of our most vulnerable children are able to benefit from our very best early care and education settings. And last, I'd like to talk about the importance of policies that can provide much stronger support to parents. So let's talk first about the need to increase families' access to early care and education. We know that the current supply of programs that serve low-income children, especially infants and toddlers, falls far short of what we need. For these very young children, children 0 to 3, early Head Start and home visiting programs can provide really critical supports for children's language development and their social emotional growth by promoting responsive and nurturing parenting. But unfortunately, Early Head Start serves under 4% of eligible children 0 to 3. So here's a program that has known effectiveness at an age that is so critical, serving a very small percentage of children. And our federal and state-funded home visiting programs also serve a fraction of very young children. So the story of children lacking access to early care and education continues into the preschool years, even though overall we do have better investments for older children. So Head Start serves 42% of eligible 3- and 4-year-olds. Better, but not great, not where we should be. And although 40 states have pre-kindergarten programs, they serve the same number of children, about 1.3 million, as they did in 2010. So although some states have expanded their programs, nationally we haven't seen the growth in that sector that we need. And then we have a problem of long waiting lists for subsidized child care and co-pays for child care that are too high. So we have 19 states that have waiting lists or frozen enrollment for subsidized child care for low-income families. We know that in 11 of these states, these waiting lists are 5,000 families and greater, and they're in the tens of thousands in a number of states. I think Florida has a waiting list over 60,000 children waiting for subsidized child care. And keep in mind that many states don't even keep track of the families they can't serve, so we really don't know the true number. It's higher. Now, 25 states have co-payments for subsidized child care that are over 10% of family poverty, or the federal poverty line for low-income families. And this means that many families can't even afford subsidized childcare. So they're not even getting on the waiting list because they know that they probably won't be able to afford care. So in light of these facts, it's not surprising that there are strong voices for expanding early care and education, including ours at NCCP, and for really reducing those co-payments so that we can make care more affordable. But along with expansion and affordability measures, we also need significant new investments in the quality of programs. In the past decade, there's really been a shift in our view of early care and education programs in different kinds of settings. Now I think there's a wide agreement, with the exception of a few states, that whether you're a child in a Head Start program, a pre-kindergarten program, or a child care setting, that program should provide very rich early learning experiences so that children can succeed. And that means, from a policy perspective, that we need to invest in the full range of supports for quality across all of these settings. But right now, child care programs are operating with such limited funding in many places and under such weak regulations that basic features of quality are not even being met. And these include recommendations for child-staff ratios and adequate salaries for teachers so that we can retain qualified teachers. Currently, and this always surprises me, only 4 states adhere to the recommended child-staff ratios and to group size, only 4 states. And this really has to change if we want these to be places where children learn and thrive. Now, we also need policies that target funding on the most effective types of professional development. Professional development, training, and on-site coaching are all key to quality improvement. And there's a lot of money going into this across the country, especially in states that are implementing quality rating improvement systems. But right now, our policies allow funding for teacher training and quality assistance that may not even target the teaching practices that are known to promote children's early learning in key areas, early language development, social emotional growth, early math, those important foundational competencies. And this is despite the fact that we have a growing research base that tells us what effective and promising technical assistance looks like. So we really need to start directing our very limited public dollars to those forms of quality improvement that will make a difference. And last, thinking about quality, I think we need to really begin to build the capacity of early care and education programs to engage in continuous quality improvement. And that means something as basic as having enough staffing, enough resources in the program so that there are enough staff that would allow teachers planning time so they can design rich learning experiences for children. And it also means directing more professional development to directors so that they can gain the skills they need to be effective educational leaders. So that's a very tall order for quality, but that's really what it's going to take to see the outcomes we want. Now, a few words about continuity and supports for children's development. We're learning, and this shouldn't be a surprise, that children who have more years of continuous experience in high-quality early learning settings have the best outcomes. So our policies really need to reflect this need for continuity. We should promote longer periods of eligibility for child care, and I think that is in some of our federal proposals, and some states are also beginning to do this. And we need to encourage multiple years of participation in Head Start and other high-quality programs. We also need policies that encourage all types of early learning programs to offer formal assistance to families to transition children to the next program. So for example, every home visiting program, when it's ending with a family, should work to help a child become enrolled in Head Start or another high-quality program. And I think these continuity policies could really help maximize our investments in early learning by helping children build on the learning gains that they're making over time, as opposed to having them lose those gains and then try to catch up in the next setting. So while we're focused on ways to expand high-quality early learning programs, we need to make sure that we are not leaving behind these groups of our most vulnerable children. These children experience a lot of instability in their lives, and they may not have a family member or anyone else to help them become enrolled in a high-quality early care setting. So let's think for a moment about young children who are in foster care or otherwise involved in the child welfare system. We know that all of these children show exceptionally high rates of health and developmental problems. They're also at high risk for school difficulties and behavior problems. They have the most to benefit from early care and education programs, and so we need much more intentional efforts to increase their participation. And although we did have some federally funded demonstration projects to address this need a few years ago, it's really the right time now to renew and intensify this effort. I'd also say that young children in foster care would benefit if they and their foster parents could participate more in home visiting programs, which generally haven't targeted children in foster care. So we need incentives to make this happen. I'll turn now to the final policy area I want to comment on, and that is support for parents. We currently have very weak investments in support for parents, despite solid research that parents play such a critical role in children's early learning and development. So for example, very few preschool programs or child care programs offer meaningful parent engagement activities. And we now have a growing knowledge base about promising practices and evidence-based models that should be much more available to parents in preschool and child care settings. There's a need for both funding but also professional development to help programs use these models. And we also need some research-based standards for effective parent engagement in early learning programs. We know from the research that the payoff can be quite significant. Gains for children are seen above and beyond what we can get from a high-quality program. It's added value. In addition to parent engagement in preschool programs, we need policies that offer parents timely access to needed supports, whether this is parent guidance or financial assistance. And we have a number of very promising family support models that really should be in many more communities. One of these you may have heard of is Help Me Grow. Started in Connecticut and is now in 19 states. Connecticut actually has an office that's helping with the implementation and spread of Help Me Grow. So in Help Me Grow communities, child health providers are trained to do developmental screening to identify developmental risk or problems early on. And there are specialized staff to work with service providers in the community to help them network and share information about available supports in the community, including parent education and financial assistance for families. And all of this strengthens the community's ability to respond to families when either a professional or a parent calls a centralized telephone line for assistance, so that there's that very easy access to help when parents need it. Then the Help Me Grow care coordinators link families to needed supports. And there are other models as well. Another one is the School of the 21st Century, which was designed by Dr. Ed Ziegler at Yale. And this model integrates parent and early childhood education and other family supports in public schools, making the school a kind of hub of really essential resources for families in the community. And many states have at least some community family resource centers. All of these models, I think, are important because they have the capacity to quickly respond to families' needs, to do this over time, and to offer supports that are really customized to families' circumstances. Last, I want to talk for just a moment about promoting parent health and mental health. Coverage for health care is a critical support for children for parents whose children can thrive only if they can devote the attention and the energy that they need to the sometimes daunting task of parenting. Well, because only 26 states have taken up Medicaid expansion, large numbers of poor and low-income parents will not have coverage for health care that would help them get treatment for conditions, including mental health problems that could really interfere with parenting. And this is a map from the Kaiser Family Foundation that shows how states are covering parents of dependent children. So among states that have not adopted Medicaid expansion, 14 provide Medicaid coverage only to parents below 50% of the poverty line. Those are the dark states on this map. And the threshold is so low in some states. In Alabama, a parent has to be at 16% of the federal poverty line to get Medicaid. In Florida, it's 35%, and in Indiana, 24%, just to give you some examples. So parents who are above that line will not get Medicaid, and they're too poor to qualify for those great subsidies that more affluent parents can use to buy insurance in the marketplace. A 2007 Kaiser study found that about a quarter of uninsured parents report being in only poor or fair health, and half have a chronic health condition. So for any of us who have tried to meet work or family responsibilities when we're ill, we can really see that children need parents with health coverage. I will close by saying that our state and federal policies can and should provide much better pathways for children. We can compare a child in poverty who has received high-quality care and education from the earliest years to one who has had, say, sporadic care in mediocre settings. And from everything we know, the first child is on a much better path to learning to read, to forming positive relationships with peers and teachers, and to succeeding in school. But right now, stepping onto this path really depends much too much on the state or community that a child happens to live in, and really just sheer luck of landing in a program that is providing the supports that the child needs, programs that are more the exception than the rule. So I'm really looking forward to hearing from our other panelists and also later from the audience members about how a variety of stakeholders at different levels can really help move more children onto the right path. Thank you.